First of all, I can understand this is a very, very difficult time for everybody because when you have got lunch to go, especially even for the panel of experts and even for the audience, it's a very difficult time. We had our session in Hall A, but I think they overextended their time, and then Raza and I thought that we'll go very quick. But since what he has talked and what I'm going to talk about, dono mein cohesion hai, so therefore I'll take a very little bit of your time. But I'm sure that something which I'm going to talk about is a little bit eye-opening for everybody. So thank you all for the audience, and especially for my panel of experts for bearing me and for bearing of all. कल conference start हुई तो we were talking about inaugural session पे कि rural areas are very important for us. There is a different kind of dynamics in the rural area. Mental health rural area में बहुत सफ़र कर रही है. What can we do about mental health? How can we change the dynamics? क्या हमारे challenges हैं, क्या हमारे opportunities हैं? But since yesterday till now, we are still talking about different things. But what is very essential and important to know is कि हम खड़े कहाँ हैं? So when Raza talks about this big survey, and I have a huge applaud for him, when he started this survey, despite all criticism and difficulties, he took this challenge, and now he's presenting you some data कि what are the ground realities. ऐसी ही एक ground reality मैं आपको present करना चाह रहा हूँ in very small time. And when you see on this slide, I put down कि जो हमारी mental health care facilities in Pakistan. When I write down developing countries, I'm going to focus more on Pakistan. हमारी opportunities और challenges यहाँ क्या हैं? So my presentation is going to take you on both things. Where are we, where do we stand, and what can we do? With different positions that I hold, I try to link up things कि हम चीज़ों को link करके कम time में cost effectively कितना बेहतर कुछ कर सकते हैं. I won't go to this slide more because all of you know, because mental health की हम बात करते हैं, generally we know that's about 1 in 8 people who are living with a mental health problem. Just showed you slides about anxiety and depression, and these are some of the global statistics which are not very good, and they're quite worrying for us. 301 million people have got an anxiety, and then you've got 280 million people with depression and lots of other disorders that you see on this slide. I won't go into the details because you will have a survey coming from Pakistan also. लेकिन उसके मुकाबले में आपकी जो services हैं वो क्या हैं? And that's what is worrying for us. And I'm talking about services in Pakistan, not globally. So you've got 3,729 outpatient facilities, mental health facilities across Pakistan. And you've got 343.3 end users. So the ratio globally is about 1 psychiatrist for 200,000 people. It is more diverse and more grave in Pakistan. The healthcare expenditures and no need to mention 0.4% पे. Afghanistan also has even better expenditures of more than 2% for their health budget or for the mental health budget. अब मुश्किल हुई 2020 में when you had COVID. Nobody was prepared. Nobody in the world was prepared. So no specialty was prepared. Mental health again obviously was not prepared. So the figure जो मैं आपको दिखा रहा हूँ that comes from two countries, comes from Pakistan, it comes from Bangladesh, because एक study जो मैं आपको बता रहा हूँ which we did was engaging two countries to find a comparison. So Bangladesh में आप देखेंगे 2021 तक एक peak रही of the deaths that people were dying because of COVID. In Pakistan you find a lot of peaks coming over when people were dying because of COVID. So सारा कुछ होने पे we went into a research grant which was called as IMPAS. IMPAS was funded by the Medical Research Council in UK, और aim क्या था? Among different other objectives, the main aim was to explore the impact of COVID-19 pandemic on the lives of people who have got severe mental illnesses and also mental health services in both countries. I'm not going to talk about Bangladesh, I'm only going to talk about Pakistan. जब हमें ग्रांट मिली तो हमें ख्याल आया कि पाकिस्तान के अंदर जो हमारी हेल्थ केयर फैसिलिटी, द मेंटल हेल्थ केयर फैसिलिटीज़ हैं, लेट्स ट्राई फाइंड आउट के वेयर दे स्टैंड, उनकी कैपेसिटीज़ क्या हैं. अभी तो कोविड स्टार्ट हुआ है, तो हम देखें कि उनकी कैपेसिटीज़ क्या है और कोविड से कितना डिस्टर्ब हुई है और कोविड के बाद क्या उनके साथ हो सकता है और व्हाट इज़ द फ्यूचर. This was a very big collaborative project. So we had this University of York, Pakistan Psychiatric Society was on board. We had our Institute of Psychiatry in RMU, and then we had the NIHR, the UK Aid Foundation. The universities here, Southampton, Leeds, were with us. The WHO Geneva office worked with us, and then we had some organizations coming from Bangladesh, which you see, and then the London School of Economics and Political Science. जो हमारा क्वेश्चन है वो क्या था, what were we trying to find out? We were trying to do a national mental health survey of the mental health facilities. I will not go into the details of what was happening to the caregivers or what was happening to the consultations, what people thought of vaccination and anything else. So this survey was done between May 2020 and March 2023 तक. So ये कंटिन्यू किया हमने इस सर्वे को. अब सर्वे में हमने एक्सप्लोर क्या करा, हमने देखना, और ये हमारी पाकिस्तान की मेंटल हेल्थ फैसिलिटीज़ की बात करो, नॉट अबाउट एनीबडी एल्स, कि हमारा इंफ्रास्ट्रक्चर क्या है, हम सर्विसेज क्या प्रोवाइड करें, हमारे पास स्टाफ कितना है, हमारी ट्रेनिंग क्या है, हमारी एजुकेशनल सर्विसेज कितनी डिस्टर्ब हुई हैं, हमारी मेडिकल रिकॉर्ड कीपिंग कितनी ख़राब हुई है, इम्पैक्ट क्या हुआ है, एंड दैन वैक्सीनेशन रिलेटेड इश्यूज़. अब ये वो सारे इंस्टीट्यूशंस हैं जो पाकिस्तान के हैं. सो व्हेन यू सी दोज starting from Islamabad, you get PIMS, you got Shifa, you got NASCOM, KRL. Punjab mein you find Mayo Hospital, services, Jinnah, Gangaram, Gulab Devi Hospital. I'm not going to go into the details. आप कुछ देर इस स्लाइड को देख सकते हैं. You can find out that we had about 17 different institutions from Punjab. We had a number of institutions from Sindh. So Raza was presenting, he was working at DOT then. We have got JPMC. We've got institutions from Hyderabad and Ladkana, Khairpur, where we talked about yesterday. We had the Vice Chancellor from Khairpur coming over. We had institutions from Azad Kashmir, then Balochistan, then KPK. So all these institutions, we were on board. We wanted to find out across the board that what has happened. So total number जो हमारे पास 55 थे. It was all done electronically using digital methods because COVID thought it was not possible to travel, but it was done very lucratively so that all data was very clean and was sent to assessors and for analysis very quickly. So out of them, 31 responded. अब अगर आप facilities देखें तो उसमें you find out those tertiary care facilities जो 41.9% हैं, which were attached to the university. But then there was 51.6 facilities जो कि tertiary care ही हैं, लेकिन they did not have a university cover, and then you had a 6.5% who were from the secondary care. So in general, आपकी जो mental health care facilities हैं, almost about 80% responded. अब infrastructure देखें, जब मैं current की बात कर रहा हूँ तो this is about that time when COVID was there, and what was before that. Infrastructure में तो बहुत changes आए हैं कि आपके psychiatrists जो हैं, जो 116 थे before COVID, that increased to 126. ट्रेनीज़ भी आपके इंक्रीज़ हुए फ्रॉम 190 to 261. नर्सेज भी इंक्रीज़ हो गई, रादर डिक्रीज़ हो गई, और ऑलमोस्ट द सेम 85 to 83. बट द वरिंग थिंग वॉज कि डिस्पाइट एवरीथिंग, डिस्पाइट ऑल आवर एफर्ट्स, डिस्पाइट एवरीथिंग दैट वी डिड विद WHO and otherwise, 16 out of 31 OPD services were functional, which means कि आपकी आधी से ज़्यादा OPD फैसिलिटीज़ नॉन फंक्शनल हो गई. आपके 13 out of 25 inpatient services functional थी, so more than half went unfunctional or were not functioning. Similarly, आपकी emergency services जो हैं वो 21 out of 31 functioning थी. ये वो डेटा है जो उन लोगों ने बताया who are working those facilities. अगर हम यहाँ पे कंपेयर करें न्यू रजिस्ट्रेशंस को और फॉलोअप्स को विद पेशेंट्स who were coming to different mental health facilities, so 2019 के कंपैरिजन में 2020 देखें तो obviously it falls down. But even 2020 के बाद 2021 में we were not able to sustain. So even the graphs did go up high, but again we had difficulties. And when you go over to ECT, which is very called as stigmatized, but is one of the mainstays of our treatment. अगर आप इसमें graphs देखें, the green ones which says कि आपने inpatient कितनी आप procedures कर रहे थे, तो almost zero पे चले गए. 2020 में भी, 2021 में भी. So we could not sustain that facility. अब प्रॉब्लम क्यों हुई? Why could not people use those services? Because obviously people were not presenting. That was the main reason COVID आ गया. Cancellation of elective care. जो हम admissions करते थे वो हमने रोक दिए. We had no wards because we are doing all COVID work. Staff insufficient हो गया. जो redeployment है mental staff की वो कहीं और चली गई. सारे लोग COVID में जाके काम कर रहे हैं. Travel restrictions थी. Inpatient services available ही नहीं है. आपने बंद कर दिए wards. जो फैसिलिटी हैं उसको आपने डेजिग्नेट कर दिया कि साहब हम कोविड के लिए यूज़ करेंगे. मेडिसिन आपके पास है नहीं क्योंकि द बजट्स वेंट टू समवेयर एल्स. यू हैड नो बजट फॉर योर ड्रग्स फॉर मेंटल हेल्थ. एंड देन क्लोजर ऑफ आउट पेशेंट सर्विसेज बिकॉज हेल्थ अथॉरिटीज़ ने कहा कि आप इसको कोविड हॉस्पिटल्स बना दें. आई एम जस्ट गिविंग यू दिस आइडिया कि ये तो एक डिज़ास्टर था जिससे हमें बहुत कुछ सीखना चाहिए और सीखना चाहिए था. आई डू नॉट नो कि हमने कितना सीख लिया है, बट दिस इज़ अ ग्राउंड रियलिटी विच इज़ देयर. And then you had difficulties with the PP, you had to close OPDs because of the admin issues. So problem ये है कि सारे पेंडेमिक में तकरीबन 50% आपकी फैसिलिटीज़ ड्रॉप हो गई. आपके हॉस्पिटल्स बंद हो गए तो आपने कहा कि फ़ोन लाइन्स शुरू करें, हेल्पलाइंस बनाएं, वीडियो कॉल, मैसेजेस, बट ओनली 16 वर एबल टू डू इट बिकॉज बाकी के पास फैसिलिटी नहीं थी. अब आज हम अगर 2023 में आके एक लोगो लॉन्च करते हैं कि हम रूरल हेल्थ सर्विस की बात करें और हम डायनामिक्स को देखते हैं और हमने सोचना है कि हम इन एरियाज़ में क्या कर सकते हैं. आई थिंक इट्स अ बिग थिंग टू थिंक एट दिस टाइम कि हमारी जो स्पेशलाइज्ड हॉस्पिटल्स हैं आर दे वेरी इक्विप्ड टू एंगेज इनटू अनदर डिजास्टर. दैट्स अ बिग क्वेश्चन. सो 8 आउट ऑफ 31 हॉस्पिटल्स जो हैं वो OPDs कर रहे थे, बाकी लोग नहीं कर रहे थे. मेन कॉजेज़ I think I've already talked about, so I'll just skip this slide in the paucity of time. अब हमने करना क्या था? So सबसे पहला काम तो ये कि लोगों ने टेलीमेडिसिन या टेली साइकाइट्री यूज़ करनी शुरू की. उन्होंने साइको सोशल सपोर्ट हेल्पलाइंस बना ली, ट्रेनिंग करनी शुरू कर दी साइको सोशल सपोर्ट की. प्रॉब्लम ये होती है कि जब हमारे पास प्रॉब्लम आती है तो हम सब कुछ करते हैं, जब प्रॉब्लम गुजर जाती है तो हम खामोशी कर लेते हैं. एंड अनफॉर्चुनेटली दैट्स व्हाट इज़ हैपनिंग नाउ. I have been hearing to presentations from yesterday, and there are very less presentations where people would talk about some psychosocial interventions. We are not talking about that if you do not have people to do something for mental health. Pakistan में इस वक्त 900 psychiatrists हैं, as per my very evidence-based digging out, and then you have got very few facilities who could provide that mental health facility. सो क्वेश्चन ये है कि आप सिर्फ फार्माकोलॉजिकल मैनेजमेंट पे सारा काम नहीं कर सकते. यू हैव टू कॉन्सेंट्रेट ऑन द नॉन फार्माकोलॉजिकल इश्यूज़. सो साइको सोशल सपोर्ट के लिए लोग बीच में आए, ट्रेनिंग्स भी की बहुत सारी. प्रायोरिटीज़ हमारी क्या हैं? मेंटल हेल्थ की उनको भी आइडेंटिफाई किया. सेल्फ हेल्प और डिजिटल इंटरवेंशंस भी हमने किए. एंड आई एम वेरी हैप्पी दैट प्रोफेसर इकबाल आफरीदी इज़ हियर बिकॉज ही इज़ द वन पर्सन हु initiated this idea of having digitalization in mental health, and he's after it with registries and doing a lot of good work. So recruitments करना शुरू कर दी, role shifting शुरू हो गई. लेकिन the question is कि हमारा जो issue है वो सिर्फ इन सर्विसेज से हल नहीं हुआ. सो टेली साइकाइट्री हमने इस्टेब्लिश तो की, लेकिन बिकॉज ऑफ नॉट हैविंग दैट इंटरनेट फैसिलिटी ओवर ओनली 17 आउट ऑफ 31 हॉस्पिटल्स फॉर यूजिंग दिस फैसिलिटी. सो क्वेश्चन ये है कि इस वक्त खुदा न खास्ता एक और डिजास्टर है तो वेयर आर वी प्रिपेयर्ड? द सिंपल आंसर इज़ नो. सिर्फ 15 अस्पताल ऐसे थे हु वर इन्फॉर्मिंग पीपल अबाउट व्हाट फैसिलिटीज़ दे हैव. लोगों को पता ही नहीं था कि करना क्या है, जाना कहाँ है, हेल्प कहाँ से लेनी है. नो अवेयरनेस एट ऑल. जो 24 out of 25 hospitals who had this telepsychiatry services were having some representatives, not otherwise. So 18 out of 23 hospitals they continued, और जैसे कोविड का इम्पैक्ट कम हुआ they stopped that services. टेलीसाइकाइट्री लोग यूज़ करें, 2019 में कम था, 2020 में ज़्यादा हुआ. एंड दिस इज़ अ स्टैटिस्टिकल एविडेंस. अगेन इट फेल डाउन इन 2023. So I'll end with my last few slides. What should we do about it? Both countries had the same statistics. We had difficulties in controlling the COVID. We had these services like telepsychiatry and etc. But then the big question is, when Raza talks to you about the massive burden of mental health, are we hand in hand in what we are doing? The simple answer is no. So what we did was, we tried कि अगर हम ये सब काम करके छोड़ देंगे इसका फ़ायदा नहीं, इसको disseminate करें. So we had stakeholders meetings both in Bangladesh and Pakistan in 2022 and 2023. And we formed a consensus statement कि हमने implementation के लिए universal health coverage की कल बात हो रही थी जिसमें mental health नहीं include, उसको कैसे include कराएं. And that has been sent to the ministry, that has been sent to the Prime Minister House, even at that time and in the recent meetings, कि how can we get mental health into this universal health coverage. Seeing referrals की हम बात करते हैं लेकिन we do not have a methodology for it. Telemedicine and telepsychiatry as said started, continued for some time and then faded out. And then हमारा कोई feedback mechanism नहीं है, not from any community or from the consultants about any successful strategies. The same thing is that the government now has formed a national action framework for 2021 to 2030. It is made by the Ministry of Health. The federal government has done it. The provincial governments are on board with it. What they want is to decentralize current services ko. So the provinces should have a decentralization. The institutions should have a decentralization, but they should be able to have a supervision about awareness, about priority setting, and setting up a national mental health helpline. So national mental health policy, again, PPS is on board. It has been initiated. 2 meetings have occurred. The whole idea is that problem hai, problem ko hal karna hai. So that's one opportunity that we had this challenge, we had this opportunity, and that's what we need to do, something about it. So I think the same thing that we've been talking about, that we should integrate mental health into different intersectoral collaborative efforts, and we should generate some outcomes. And that was being highlighted by both countries, even Bangladesh and Pakistan. So I end myself over here with the possible time, and thank you for listening to me patiently. Thank you.